All right, what's going on, macro perspective peeps? Oh my goodness, I am super excited. This is round two, and we get Marcos this time, where we're going to be able to really drill down on some amazing topics today. Today, we've got Natalie Samson of Golden Genetics. She had previously come on. We had a broad talk on genetics, genetic counseling, and what she's done in this space. So it just made sense to really bring her back. I think this topic is still very much it's getting out there, but I don't think there's a lot of great speakers and expertise that can speak on it with confidence, yet tie in everything holistically. And I think Natalie's been doing a great job of that. I met her earlier this year, and just seeing her talk about genetics, the specifics, but then also just the broad practical approaches that people should think about. I think she does a great job conveying. So that's why we have to have her for round two. I'm going to let Marcos ask some key questions I think you guys will find amazing as well. Natalie, thanks so much for being here for round two. Can you introduce yourself for the folks? What's been going on the last few months for you as well? Give them a little update, and we'll get right into the convo.
Totally. Yeah. Thank you so much for having me back on. So excited to chat. That was like such a meaningful intro for me too, because that is my goal, trying to make genetics understandable. So I am a board certified genetic counselor. When I say that, no one knows what that means. So basically, we help translate the genetic information for patients to make it meaningful and actionable. We also help pick the appropriate genetic tests for patients. And so we have a healthcare background in genetics and psychology to be able to do those things. So it's really like helpful and amazing to be in the space with that role right now with all the genetic tests that exist right now. And so, yeah, we have a private practice that helps patients do that, but from a holistic perspective. And so we try to take, family and personal history into account as well as patients' goals before we pick the test, and then we help them understand it and come up with a plan.
Love it, love it, love it.
Well said. Easy digestible version of board certification and what you do specifically for the audience. As you're aware, we're board certified health coaches. And what does that even mean? Is what we get asked
Yeah.
all the time. I feel
Yeah.
like it's always a convoluted way. It's like, look, guys, at the end of the day, we're just trying to better ourselves, quote, professionally, which sometimes might seem like a stroke to the ego when it's really not. It's just more of like there's paths to just make it seem like there's more credence to what we're doing. And so therefore board certification is where you go. Fun fact, like board certified physicians versus physicians that come out of med school, there are differences there. So like when people are like, hey, I'm a board certified physician, like those are things to look out for. Like it means typically that they have to stay up to date with relevant information. So the board certifications is really like kind of a way of kind of like separating yourselves and sussing out whether or not someone's still like trying to be legit. So again, like keeping up on CEUs and all those additional educational units is basically what it means. Like for Natalie to retain that title, for us to retain that title. I mean, for us, what, Seamus, it's 12 hours per year, right?
Yeah, something like that, or 36 hours. Yeah, 12 hours per year, 36 every 2 to 3, or something like that.
Yeah. And then probably for you, Natalie, how many hours you gotta like work for your continuing education units to maintain your credential?
I like just renewed my California license. So we have certain hours for the national boards and then we have certain hours for California. Do you guys have that too?
No,
Probably.
ours
No,
is
we
just
just have
ours
the
is
Okay,
just
one.
national.
nationwide. Yeah.
Yeah. Yeah, yeah. So we have certain states that we're licensed in too. So we have to do extra education for those states to maintain that licensure. But I think
Yeah.
you were saying like it was that's such a good point, Marcos, because I think there's a lot of people that one, like I would say there's people who aren't up to date with current research and like what's going on. And like genetics is such a rapidly evolving field that piece is so important. And then, yeah, the second part, like you were saying, is like for us, we had to pass the worst test ever, but it's helpful to know that, you like had to study and that knowledge. So yeah, I think it's like you said, it's like, when you're not in the healthcare space, a lot of people are like, okay, I don't know what that means. Like, why does that matter for me? But like you said, I think it's helpful for people to realize it's like work.
Well, and I'll say this like this last year doing like a business networking group and like saying that to a room of 50 like people that are not in like healthcare in the industry, it's like but what does it even mean, right? Like there was another person who was like a certified coach, right? And there's really only two credentials that even certify coaches from a coaching perspective, right? The health, like the board for health and wellness coaching, and then her particular title, right? So it's like there's very limited actual like ones that are having like a lot of rigor to like maintain the title. So again, people, I mean, I feel like that's an important education lesson to help like just differentiate, like again, someone else that's like maybe just working for you in the beginning as they're then, trying to get that tutelage to then move on to that next step, right? Like, and I know, like you just said, like for your guys's, coaching or for your counseling, it's going to be a little bit different, and because you have like a state by state basis. And yeah, like guys, healthcare, like you would think that it's really freaking simple, but it's not. Every state plays by its own set of rules, and then you have the federal level. It's really why everything's just so complicated today, day and age. So Natalie, this leads me into my first question though. All right, cool. So you were saying picking the right genetic test for you, right? How would one do that? Granted, we've had other people come on here that were affiliated with X4, as there was the company that Seamus formerly worked for that I still work for. We utilize that as a way to kind of help give better insight to patients. But again, like, is that really the best test for our patients? Or is it just more like a act of convenience because we want to offer that service? And how would you go about approaching that?
Yeah, such a good question. So, I think that one thing I always kind of like to differentiate for people too is that in the world of genetic testing, there's these two worlds. One world is more diagnostic medical high risk testing, and a lot of that type of testing is actually the testing that one, like as genetic counselors we're trained in, but two is being offered in more of the traditional space. So that would include things like high risk cancer genes, like BRCA mutations. People often hear of, dementias such as frontal temporal dementia and vascular dementia, early onset Alzheimer's. And then also preconception and pediatrics for autism fall into that category. There's also, even more than that, but those are just a few examples. Even like connective tissue disorders, like genetic testing for Ehlers-Danlos syndrome, which seems to be trending right now as a topic, that falls into the medical diagnostic space. And then we have like the functional lifestyle nutrigenomics space. And I think that really the key is how can we combine them for patients in a lot of ways. Not everyone needs the medical diagnostic testing, but I think that it's usually like when you're in the traditional world, the functional testing's left out. And when you're in the functional world, the medical testing is left out. So a lot of times when I see patients, that's why we do the personal and family history, because sometimes if a patient has, a parent who's diagnosed with breast cancer at 50 and then their grandparent was diagnosed with pancreatic cancer, like we wouldn't want to not test those high risk cancer genes because those can help the patient be proactive. But I think combining that test with a test like 3x4 is essential. And 3x4 is kind of special. So I love that you guys use it too, because it's very holistic and it covers so many different pathways, and it's systems based, which is the way we want to look at it when we're looking at that testing. So I think any patient could really benefit from a 3x4 test. And then we just want to make sure we're not leaving out the medical side of things if it's going to help the patient as well. But I will say, like on the functional genomic side of things, 3x4 being an amazing test, there are a lot of tests that aren't amazing, like, tests that are looking at 10 methylation genes, for example, and giving a bunch of supplements. And so I think that's just something people should be wary of too, is like, because the genetic testing world has exploded, there is a lot of marketing and sales in that space, and it's not always for the patient's best interest.
It's it's funny because like epigenetics has gained a lot of steam here in probably the last 5 years. Quite frankly, because most of us never really heard about an mRNA thing until like COVID, right? So as a result, like you have this uptick in these ideas and thoughts about like gene therapies, right? And then understanding genes is like obviously the inevitable step, and then it's exploding, right? And it's funny because actually my my aunt, I'm like trying to think of like relationship here,
Family
my
tree.
aunt, yeah, right. So she's been like learning and doing, and I forget exactly what like field of research and like epigenetics for like the last 2 decades, and it's like early infancy phases. She's like, yeah, did you know that there's like ways that the genes like basically tell a whole story of something else, and like they kind of break the chain, and then like boom, like like, and I was like, man, funny. I felt like I was hearing this from her, like my mom talking to her, when my mom first got cancer 20 years ago, and as a result, it's like, oh yeah, like wouldn't you want to kind of know if you had the potential for these things to, what that increased risk factor is and how it might influence your lifestyle decisions. So yeah, I feel like it has been a little cyclical. It is trendy. And like you said, as it gets trendy, there's more ad spend in it. And then you're like, yeah, like I need to do all these different tests. But like, to my understanding though, your genes shouldn't change. So one test should cover everything, right?
Yeah, technically. So it depends though on what genes you're testing for. So like 3X4, for example, tests for I think like 200 around 200 genes or something. And so you'll never have to retest for those genes. However, like 3X4 doesn't include like hereditary medical testing. And so if we did like a cancer hereditary test on a patient, that's a separate panel, but technically we only have to do that panel one time too. So I think something that people are confused about too is like there's not one genetic test that looks at everything. Even whole exome and whole genome sequencing, which is kind of coming out in popularity, there's over 20,000 genes in our body. So even when we're looking at whole genome or whole exome, the lab who sequences the genome or exome will only report certain variants that they think are relevant for the patient's history or whatever they pick. So it's not like they're just reporting every gene. So that's why we have to pick like what panels we're going to do for that patient. But once the patient does those panels, it's not like they'll need to retest for that gene.
And correct me if I'm wrong, like, isn't part of like the big buzz around this the fact that it could lead to like specific, like again, like you said, like you kind of like said, like there's a company that like tests these 10 things and they just sell you supplements. But like, isn't that really like kind of where it's trending is like you can basically, with understanding the genes, understand the proper like treatment plan for an individual when it comes to like again, like medications that they should be utilizing in order to help with like outcomes.
Totally. Yeah, definitely. And I think that, there is something to be said about, I mean, ultimately, I think the power of genetics is personalized medicine and precision medicine. So I do think that it can help with supplementation. But when we're thinking about supplementation, it's better to look at like a lot more genes than 10. But when
Mhm.
we're thinking about pharmaceuticals, there's actually a specific test called pharmacogenetics or pharmacogenomics which
Mm.
does look at genes associated with medication metabolism. And so when we run that test for patients, it can be so helpful because it literally can tell you which medications, one, that you probably need adjusting or adjustments in dosing, or two, will give you side effects. And so, like, for example, I just had a patient last week who has been on the SSRI like trial and error situation
Mhm.
for a couple of years. And I don't know why her psychiatrist didn't look into pharmacogenetics because it is like actually becoming very mainstream in healthcare. But anyways, we found the appropriate SSRI that she should be on and told her the exact dosage, and she was like, "This is the one that's working." So we could have skipped all of the trial and error. So it's actually such a beneficial test. I think honestly, it's one of those tests where I think everyone should do as well, just to have in your medical chart because it looks at like pain medications. And even if someone's like, I never want to be on a pharmaceutical, there could be a time where you might have to take something. And so it's like you might as well know which one, would be best for you.
I love that. I'm just chime in, but like that's the one that I'm now with Jeopardy, the company I'm with, like that like I've been telling them about like pharmacogenomics. Like you guys got to really get this going because that lab work, when we get the pharmacogenomics with it, we'll know everything about this member. And if we decide to do something with them, it'll be great. I think the SSRI is one example, but like another is like I just had a conversation with someone that like wasn't doing well with a certain statin, and I'm like, do they run like a genomics panel on like which one works for you? And she's like, no, I'm getting all these side effects. I'm like, great, And so
Exactly.
she's in this whole trial and run thing, and I feel like once you have that specific thing, it's like now you have like the 10 systems that you need, and at least you know which medication you need if you ever need to get on them. Obviously, we're going to try to mitigate that, but at least you know. So instead of having to like, I mean, SSRIs can just be could be so like hard on somebody, and to spend like years having to handle that, like when you could have just ran one test and like that could have been
Totally.
it. It just, yeah, the complications of not doing the test.
Mhm.
Yeah. And there's not pharmacogenetic data for every medication out there, but we're moving so quickly with the research that there is a lot for a lot of common ones, like statins, like you mentioned, and even certain chemo prevention and chemotherapies, which is also so helpful. Trying to think, yeah, sometimes it's like LDN, like low dose naltrexone is being prescribed, and we can see, you know, which receptor, like there's the opioid mu receptor, and we can see people's responses to that. So it's,
Well, I'm gonna chime in. I'm on some LDN. It's been
yeah,
great for me. It's been great for me.
perfect. Yeah,
I'm doing it for like my autoimmune, and
exactly.
I'm on like 1.5 milligrams. I'm titrating up 0.5, but I've been responding really well to it. I
Exactly.
have my genetics, and I knew I was going to be fine. And I will tell you this: I did my research. I read all the books from, what is her name? She did like 4 books on it, and one of the funniest things was she said, you know, when people get on LDN, sometimes they might just feel elated. I will tell you, the first week I was on LDN, I was like, I am so happy right now.
Wow, yeah, see, that's amazing. Yeah, so LDN, like you said, is being used for autoimmune patients in like everyone seems to be taking it and trying it on auto. And like you said, it has amazing outcomes for most patients. But I just had a patient like a couple months ago who was given LDN, and it made her wired. It made her have terrible dreams. She couldn't sleep. She had headaches. So it's like because of her pharmacogenetics, but she wasn't told why. They just kept saying, keep trying. And then we did her pharmacogenetics, and I was like actually isn't going to work for you for this reason. So yeah,
Yeah.
I think it's so helpful.
Yeah.
Mm.
That is one side effect though. The with LDN is the vivid
Dream.
dreams and sleep architecture being, even on someone that can use. I know my sleep architecture. I was like maybe like 1 or 2 days. I was like, I know it's gonna be slightly off, and I have been having more vivid dreams that I've been remembering, and I'm like, this is really odd,
Yeah,
but it's been good overall. I think I've been on like such a grind. I've been telling Marcos, like, really just attacking. Like, I really want to just change this whole infrastructure in my system, and I feel like LDN's been like a big component of it, you know.
totally. Yeah, amazing.
So,
Mm-mm.
you know, pharmacogenomics, you brought something up there. You said something along the lines of like cancer prescriptions, like cancer medications. Like, is that being more prevalent now with cancer, or like with certain medications or chemo? I just like got off a call with someone who did like 30 plus like chemo things. Like, is that something that they're trying to work on a little bit more now, Natalie?
Yeah, yeah. I'm so glad you brought this up because, and this is like to our point earlier, is that this actually is being used in really well-known cancer centers where chemotherapies are being prescribed in a precision medicine context. And so if you're given options and no one's talking about genetics with you, as a cancer patient, you should look into this because it is actually being done at most well-known centers now. But basically, there's kind of different ways that you can be precise with cancer treatment. So one of it is pharmacogenetics, but sometimes another way that we're using genetics to be more precise is that certain people who have mutations or changes in genes that in the high risk genes, we've now understood respond better to certain therapies. And then also what's happening is you can now sequence the DNA of your tumor. And so when you sequence the DNA of your tumor, it's basically giving you the like blueprint on what chemotherapy is going to work best. And so that's also being done. It's called somatic sequencing or tumor sequencing. And so oftentimes in bigger centers or like well-known centers, they're doing germline, meaning what you're born with for cancer. And then they're also doing tumor DNA sequencing. So you're getting two reports. You're getting your tumor report and your like what you were born with report. And then based on that information, they're literally choosing what chemo is going to work best for you. So at this point, like no one should have to take chemo unless they've done that test. Yeah.
Mm. Thing. Seamus, who was the individual? I like can't for the life of me remember. That was talking about the pharmacogenetics previously.
Kimia.
Kimia. Yeah.
Okay.
Yeah.
I
She's a
was like,
friend of mine.
Well, her episode never released.
is that what it was? I'm like, why can't I find the person? Because I thought the name of the title and
We had to pull her episodes due to
I forgot.
personal reasons, and not that they were bad. She just wanted,
gee, yeah.
it was like she just wanted to. She was very specific about her
Because
language.
I could have sworn that was like the whole point of the conversation. I was like, why can't I find the title on our? I was like looking at our spreadsheet of like all the people we've had. I'm like,
Yeah.
what the hell? I was like, why none of these are ringing a bell as to like that episode in my head, and that's because
That
it's not
episode's great
there.
because we went deep into the ethics of genetics too, and I was like, dang, this is like no one's ever said anything like this before. I've never
Yeah.
heard of it.
So then like yeah, the circle there, like episodes that are deeper dives into just like some of the baseline ideas of genetics as Natalie's going further is the first one with you, Natalie, obviously back at episode 142. We then had Yale
Yeah.
come on 145. I think it was right in between that. And I was like, I'm pretty sure that it was in between there for Kimia. And I'm like, but it was talking about that. And then additionally, we had
Dan.
Dan, yes, Dan Guzman with the performance genetics. So it's like we're talking about like these different like bridges and architectures of like using, you know, the genetics to understand training, you know, pharmacology, again, treatment plans, you know, things that you might want to consider as more like you just said, like this LTN, right? Or other types of like protocols that may be off-label utilization of medications that a lot of people are kind of like it's gaining, you know, evidence for. Like I could see this being really a I don't know what gene would be potentially, but why men might be more susceptible to having elevated PSA levels or you know instances of prostate cancer, and therefore it's like yeah, a low dose Cialis, you know, earlier on for someone in their 30s, even though they don't have ED, could be utilizing a something in a similar vein. So I have, you know, like there's just a lot of things that like that piques my interest a lot. Like we could probably nerd out a lot about that, but I think it's like
Do it,
kind of
Marcos. No, seriously, this is the time. Natalie, I'm
Yeah.
with you. She and I have spent a week together where I was nerding out.
Yeah.
So it's your turn.
Yeah.
yeah. Well,
Yeah.
so I mean, here's just an instance for today. For example, there was no patient name involved, but like an instance of an individual dealing with lipoprotein B, right, and the non-reductive factor of the statin medications not yielding a level that would be into the optimal ranges based on some of this new emerging data. So here's my physician, well, not mine personal one that I'm working with, but like one of the physicians in the office talking about like he's at like 80 milligrams of like atorvastatin or whatever it was, right? Or yeah, like yes, like I was like scratching my head. I was like, isn't it like 5, 10, or 20? Like maybe at
At that
most,
point, I'd
like
be looking at his liver like, yo.
Yeah.
that's exactly what he said. He's like, yes, there's other things that are coming back that are now elevated as a result of trying to chase this marker down. And he's like, look, other than this marker, everything else, he's like the pinnacle of health, like you name it. So he's like, you know, this only makes sense for an individual that may have had a stent or had some heart complications, like to try to then ramp up the amount that you're utilizing. And then also here, maybe that if they looked at the genetic profile, be like, actually, this medication is probably not the one that's best suited for you, but it might be the one that might be genetically also does come with side effect profiles. Like it's a very interesting understanding of like the whole human system versus just the genetics. So obviously, I'm leaving the office. And he's talking about this. I was like, why the hell is Dr. Lake here till like 3 p.m., which is really unusual for him because he was like, I could see his wheels were turning about like, why is my patient doing this? Like, what would possess him to do that?
That's so interesting. Yeah, I think like also testing for other genes associated with like inherited cardiomyopathies or arrhythmias, which is on like the more medical diagnostic side, is
Mhm.
sometimes it's like I feel like yeah, we get so many patients where we're like, oh my god, like we found the answer. But yeah, I think combining that again with 3xFAR so we can look at more of like the cholesterol, blood pressure, you know, more of the SNPs. But yeah, I think it's fascinating. And then looking at the medication. So I think so many people like don't realize that like everyone always asks me like who is a best candidate for you type of like who's the best patient to do genetic testing, and I was like every patient, because
Mhm.
honestly at this point we do have a genetic test that can give you some answer, like even if it's not, you know, the answer that you're coming in for, but like just some answer. Like, I mean, a medication profile is helpful for everyone. 3x4 and like understanding your cellular pathways and inflammation, oxidative stress, methylation, detox, histamine. All of those are so helpful for everyone. And then, yeah, just, you know, I think a lot of times I just had a patient that was like, wow, you solved like all the answers after like thousands of dollars spent because we found a mutation in something that was causing like her issues. So we do find like root cause, like where it comes into functional medicine, we do find root causes through genetics. So I feel like everyone really can benefit. And I think that the other important piece is that I do believe that genetic testing, honestly, the earlier the better, with the ethical considerations.
Mm-hmm.
The reason like I believe earlier the better is because I've had so many patients that already have sickness and they're like, why couldn't I know this earlier to be proactive and preventative? Also, like testing for things like celiac disease is really helpful for kids. Like if I knew I had celiac disease predisposition, it would have been really nice when I was a kid.
Mm-hmm.
I was diagnosed with celiac not till 25. But when we're thinking about the ethics for genetic counselors, we do talk about how we should wait until patients are 18 when we're testing for adult onset conditions. And that's because of autotomy. So that means patients should have the right to they should have the right to decide if they want to know that information because it's health risk information that can happen later. And so a lot of times for like high risk cancer genes or Alzheimer's, we'll tell parents that, we won't test children for those genes until they're 18 unless there is obviously like pediatric cancer or something really relevant to the kid. So I feel like outside of, adult onset high risk conditions, I do feel like functional genomic testing for kids is so helpful.
And Seamus, now you need to jog my memory. Was that in Kimia's episode that we talked more about the ethical
Dude, that
considerations,
was
or
like the
was it?
last 15 minutes.
God,
We'll have to send
okay,
Natalie the episode because it's an unreleased. It's not ever gonna be released. We'll send it to Natalie.
yeah,
And the
Yeah.
last 15
damn.
minutes, I was like, wait,
But
we needed to talk about this for another hour. And like it was like the last bit, and I was like, damn.
since that was where it was, and then it doesn't exist on the internet from our perspective, maybe we can kind of pivot to that a little bit here with that ethical consideration because I found this super fascinating, and like this is the second time I'm hearing it. So you saying what you just said isn't coming as a shock to me, but the ethical considerations of like when a parent must make a decision to choose which tests they would then know about their children, and then whether or not the children, because they're not of consenting age yet, to make a decision whether or not they want to know about these mutations, which I found fascinating. I was like, I would never think about that. And you just, what was the word again? Because I never heard that word.
Autonomy.
Autonomy, Automoy.
AUTO. I can't even I spell in my head.
I should
No,
Okay,
probably
it's still T and then it's M. Yeah, no D.
autonomy.
autonomy.
No,
Autonomy.
no, let's figure this out.
That we're gonna have to like
Someone listening is like,
someone's driving in their car right now and they're like, gosh, get it right, guys. Like
I
I
know.
know my
So
kids.
literally, also just autonomy,
Yeah,
not okay. Just autonomy. I thought you were. I was hearing a D, so I was just trying to make
I
sure.
probably, yeah, no, it's probably the way I was saying it.
Yeah.
But
Okay. So just
basically, yeah,
yeah,
it's
the right or condition of self government. Autonomy makes sense there.
Yeah, some
Okay.
self sovereignty.
exactly.
Yeah. Yeah. Okay. So your one's own autonomy, and because you are acting under the guise of guardian, right? But you've never actually got your kids' consent, like because they haven't been of consenting age. It's like a fascinating concept to me because that ethical consideration is something that like yeah, like I want to like it's like for me, my kids have allergies, right? So if there was ways to circumvent the allergies so that it would never lead to a histamine reaction, which by the way, anaphylaxis and taking your kid to the, ER if you have a high deductible plan, get ready to shell out at least like $3,500, like just for everybody out there, right?
Yeah.
Maybe consider getting a different plan if you can do it, if you are making that decision, because it definitely sucks when that's the case. Yes, you can, call and do these things and, maybe get it down to, a 30% discount or whatever it is. I may or may not know this by experience, but it's fascinating. Like, okay, well, now here's me, a parent that maybe wants to look at my kids and be able to make, again, to create a path, right? Is there a path out of this? Or is this particular, okay, actually, this is a better question for you. Is an allergic reaction something that has to do at a genetic level? Like, why are my kids have similar kind of allergies with like tree nuts, but not the same exact one? And how come I'm not allergic to it? And how does that all work? Is that related?
The histamine, the allergies genetics is like so interesting, so complex, so multifactorial. But I think that testing for the histamine genes like DAO and MT can be really helpful in this case.
Hmm.
I think that there's still genes that we, one, haven't really discovered yet or figured out how they apply to the allergical response. But I think DAO being in charge of, removing histamine out of the gut, and HNMT is in charge of removing histamine out of the nervous system. So I do tend to find that people who have allergies and then later in life, diagnoses of things like MCAS or histamine intolerance tend to have variants in those genes and have issues with high, like red wine. Like people are like, oh, I can't drink red wine. And I'm like, that's because you literally can't remove histamine out of your body. And
Mm-hmm.
so I think it's really helpful in that case. And I think there are some other like genes to consider. Celiac genes, for example, are it's such a different allergy. It's more of an immune response. So those are different. But like when we're thinking about, allergies, sensitivities, there's so many genes. It's like a mix of multiple. So,
Mm.
but I think, testing the histamine, and that's an example of like those genes I do think would be helpful to test kids. And it's like, honestly, those aren't adult onset conditions. So if you're able to figure that out and support your child, and then as they get older, help them understand their body too. Like if I understood my body as I, went into college and like beyond, I feel like you can avoid a lot of things. And so DAO enzyme being helpful when people are eating, quercetin, whatever, can be used for those genes. So yeah, I think it's like an example of how that can be helpful.
Yeah, that's like, I mean, I'm just thinking about like how we have it at the most applicable level that like a parent or why they should care more, and then how that consideration like comes to be how you might disclose that. Like you just said, if you had obviously you as a parent when you're dealing with the genetic testing in the womb, which you're looking at whatever those kind of screenings are, which I had done with both of my kids, right? And more so for my wife's sanity, right? She's like, I don't want to bring in a kid that has this potential disposition, right? And I was like, fair, right? We should know, right, what we're getting ourselves into. Selfishly, it was also like, we can know the sex of the child like way
Yeah.
earlier. It's like, yeah,
Yeah.
sick. I want to know immediately,
Yeah.
which was
NIPT.
pretty,
I
yeah,
know what
yeah,
you're talking about.
yeah, yeah.
Yeah.
What was it? That was
It's called
the,
NIPT.
okay.
When you,
What is that?
yeah, it's
What's
basically,
the
sorry,
acronym of that is
NIPS.
what NIPS?
Yeah.
Okay.
So funny. But we're looking at basically NIPS is looking at chromosome abnormalities like Down syndrome or trisomy 18 or 13, but they're also looking at the X and Y chromosomes. So it's funny, a lot of like non genetics providers will just be like, oh, we're going to do a blood test that looks at the sex of your baby. And everyone's like, okay, but we're actually also looking at screening for chromosomes. So sometimes genetic counselors will get referrals from patients that are like, I thought I was just doing a gender test and now I found out my baby has Down syndrome. And so it can be
Hmm.
like, it's definitely so important. I'm glad that like your provider told you that before, but sometimes it's, I think patients get confused, but it is a screening test too. So it's, even if it comes back as potential for Down syndrome, the woman would have to do further testing on the baby, but through amniocentesis and things like that. Anyways.
Yeah. Well, therein lies the next question of ethical decisions, which leads to a lot of tumultuous arguments across all political landscapes. So I'll not touch that. But
Yeah.
I can only imagine if a parent was to be given this information ahead of time, that would be a very difficult decision. And again, that's a lifetime of a responsibility where there is no ability for this individual to likely be operating by themselves at any point in time, right? And
Yeah.
in which I'm sure I don't even want to know how the right handles that in terms of like the viewpoint, right? Like God willed it, so it must be done. Whereas left hand side is like, well, you kind of have a decision, and I don't even know. I'm not trying to take a side on that, but I even asked my wife. I was like, well, what if my wife has an autistic brother? What if? What does that look like? And there's no way of future proofing that. And well, then there's another question for you, Natalie. Like in terms of like using genetics to understand parent A and parent B in terms of compatibility and lowering potential risk factors of these said chromosomal conditions, like is that something that exists?
Yeah, good question. And I also just want to comment on like when, it's such a hard job of prenatal genetic counselors because they work with patients of both political sides and
Hmm.
they're trying to help them navigate to come to their own decision. And obviously it is the patient's decision. So regardless of what the decision is, a lot of genetic counselors will still say that it's helpful to have the knowledge because planning can go into what happens after birth, for example.
Mm-hmm.
Anyways, I think with testing in preconception, then we're kind of getting into, so preconception testing, sometimes we can predict potential for chromosome issues, but what's more commonly ordered is a carrier screen. You may have done carrier screening.
Did not. I just went in
Okay,
there guns a blazing,
went for it.
just said this she seems right. No plan,
Yeah.
no real income to speak of, and said we're just gonna figure it out.
I probably have to do that one because Des and I are like on the
You're
foreground. I'm gonna hit up Natalie real quick. Come down to like
Yeah, hit us up.
Costa
We'll
Mesa
help
area. Be
you.
like, yo,
Exactly. I already did carrier screening on both me and my husband, so we're
hey,
ready.
do whatever you did.
Yeah. But with carrier screening, you're basically looking at recessive conditions. So, like, recessive genetic conditions are things like cystic fibrosis, Tay Sachs disease, basically conditions where you're passing, like, even though because we have 2 copies of each gene, sometimes people have one that's not working, but because they have the other that's working, they're fine. But when they pass down that non-working copy, if their partner also has a non-working copy, then the child has 2 non-working copies, then they have a recessive genetic condition, which is almost, some of these recessive conditions are also very, can be like a lot of symptoms associated with it. So it can be helpful again to see, is there something we could pass down? And there is actually options now with IVF and something called PGT, where you can do genetic testing to make sure you're not passing it down as well.
Yeah, the IVF, that one, not to not to make a joke of something very serious, but there's a comedian who's like, I did the IVF and like we got 14 eggs, which like apparently 14 eggs is like really good. I don't know how many eggs you're supposed to get, but
Yeah, that's
he
good.
goes like, if you were given the decision and they were given the decision, it's like, well, we got 14 eggs, but these are the top A student eggs. It's like,
Yeah, exactly.
I'm gonna choose those eggs. And I know it sounds like is it crazy that doesn't make the other eggs unqualified or as equal? It's like, I don't know, because like obviously you want to give your kid the leg up, or you at least don't want your kid to have the deep, disposition to be in a lower state than everybody else. You just want that even playing ground. So it's like, so IVF does it, and then what was the other one, Natalie?
Yeah. So, and like, I think with IVF too, and we combine it with something called PGT, which is called pre-implantation genetic testing. So we're just testing the embryos to see which embryo does not carry a disease mutation. So that brings up like a good ethical point. So in the world of IVF and PGT, when we do genetic testing for IVF, we can do that to avoid passing down really high risk, rare genetic conditions that entail a lot of symptoms for, or like have high risk of cancer or pediatric cancers, for example. But then there comes the question of like, a lot of people ask, are we playing God, or are we doing genetic testing on embryos to choose the gender, the hair color, the eye color? So like that is currently unethical in the US and it's not allowed. No, but that's not to say that like other places aren't necessarily doing that. So we have
CRISPR.
gotten to the point. Yeah. And then we have to think about CRISPR and designer babies. So that's like not going on in the US as far as we know. But when
Legally.
when we're doing IVF for PGT for diseases, it is actually like relatively common now for people to have that option.
That's one where we start getting into this, Marcos. A part of that ethical conversation, right, Natalie, is then access,
Mm-hmm.
right?
Yeah.
Which is like, okay, we're having this conversation, right? But if someone doesn't have access to this information, struggles in the social economics, that's the other part of ethics, is like the social economics. It's like, are they trying to make this testing so relevant that people are armed with this, or is this like only for people like us that can have this conversation, people that listen to the podcast, like someone that is educated, maybe in a higher socioeconomic place, like they college educated, like, I'm not trying to beat the bush here, but like, yeah, what are your thoughts on that? Is that something that they're trying to make more relevant?
Yeah, for sure. I think it's being more accessible to people all the time. I think it really did start off as like not being accessible to everyone, especially with costs. But now insurance plans are actually covering this depending on the plan. So some plans you can actually call your plan and say, do you cover IVF and PGT or pre-implantation genetic testing? And the plan will tell you. So insurance can actually offer coverage if there is if there is a mutation in one of the in like the mom or dad. And so yeah, I think it's becoming like more of a realistic everyday thing for people. But I think, it's getting better, I think, continuously. Um especially for like high risk diseases.
My kids will never be designer babies. Sucks to be them.
I know. There's this I know. I think a lot of people were more nervous when when the first designer baby was born, I think in Asia. Do you guys remember
Yeah.
that? Yeah.
That was not too long ago, right?
Yeah.
Correct me if I'm wrong. It was like within the last like 3 or so years, maybe?
Yeah. Yeah,
Yeah.
no one knows where they are.
Really?
No one knows where the designer baby went.
They're on the rock that just flew past the Earth at an
Yeah.
astounding speed, I'm sure.
Yeah, yeah. I think people are, like, definitely more nervous. When I tell people my job, a lot of people will be like, "Oh, do you design?" Like, it's definitely, but that's not what we do. So just putting
What's
that out there.
interesting though is we've had I'm gonna take this conversation to left field a little bit more, almost like sci-fi here, but like we had this person, Aaron DeSouza, who's the co-founder of the Enhanced games, right?
Mhm.
Um, and we are entering an era of people wanting to be as optimized as possible. No matter what kind of field you are, I think people are intrigued by being better, faster, stronger, smarter, so that they can get a leg up in life. And that's why we take supplements, or that's why we eat in a certain way, or we like sleep on whatever, right? And then there's the next level of it: peptides, drugs, steroids, hormones, whatever.
Regulators.
Bioregulators. There's going to be a point where they're like, well, that's the basic human, like doing all that. Why don't we just plug it into the human already, so they don't have to do the peptides or the things? They're already a superhuman. Feel that's a whole different philosophy, but I feel like we can get there where there are no disease states off the cusp. People are faster, stronger. Bones are like the kid could play any sport they want and kill it. Like I feel like that's
Yeah.
could be around the corner
But in
uh,
a
a little
but
bit.
isn't it what part of the human experience is that you're not dealing with a level playing field, and what makes ideas and things so awe-inspiring is the fact that it seems really difficult to reach that. But then if these feats are just like designed in, then the games and all the stuff that we look at where it's like a feat of like incredible outlier conditions of like the human potential that like make it great, right? Like it's such a I mean, again, we just create new sets of rules and things in terms of how the game is
We're
played.
just gonna hit Gattaca.
Yeah, I know,
Yeah.
that's what I was thinking.
Oh
Well,
yeah.
there's like a TED Talk, I can't remember the details about it, but it was this man saying like, it's not far away where there's gonna be like 2 kids swinging, and one's like, "Are you a designer baby?" And the other's like, "No, I'm natural." And the other's like, "Oh, I'm designed." And it's like we're like, I don't know, I think it's farther away than we think, but like, who knows, like sci-fi wise, like we're gonna have communities,
Well,
design
so
people versus not.
yeah, well, it's also yeah, well that right, and there's also like organic versus AI content, right? Like that's like the most recent iteration of that we can see effectively where robots are taking over. I love it too, though. Like my the favorite thing that I hear in recent times is like young kids talking about like, oh yeah, that AI sucks. I'm like, bro, that's not AI. Like you guys are misinterpreting just like a NPC as AI, right? Like all these conditions of like the bot that you're playing against only knows conditions. It isn't getting smarter as you're playing it, as far as I understand the context of Roblox, for example, right? So when my son is using, oh, it's like the AI sucks. I was like, nah, dude, it's not an A. You're not even dealing with an AI because it would learn and like how to make the game incrementally harder for you, that you're improving your skill set as a result of playing them. If that was really built into like the algorithm.
Yeah.
Maybe I'm wrong. Maybe it is, right? But
Yeah.
like where we're at in the world with for me, I'm always wanting to delineate and understand the differences, and also let people know the way that you speak has to have the right intention with it too. Because like you just said, are you a designer baby or are you natty? I mean, this is no different than like natty or not people like in gym culture. And if you think about it too, like most people in today's society, if we were to look back a few decades ago, how natty are you realist like in comparison to somebody 3 decades ago? Right? Like, what were
Yeah.
your parents taking, as we were kids, as their like normal supplement regimen versus like Seamus, how many nootropics, how many like off-label use medications are you currently on? How many you think about
Dude,
all
I'll
the
tell
like
you this right now. I
foreign
have a
substances that
stack.
are in your body right now,
Dude, I
right?
have a stack, and it's weird. Here's the thing. Here's the thing. I'll explain why my stack, and Natalie can chime in on this genetically. I, first off, I think I'm only just human. Second, I think I was genetically inclined, and when I look at my genetics, like it explains so much about me. Like I'm injury prone. Like so many joint injuries growing up. Obviously,
Yeah.
that comes with like being in a high risk sport, but I was more
Mm.
injured than probably most people. Right, under recovered. There was gut things that were going on, and it didn't help that my mom didn't breastfeed me. Like damn it. So like, what am I doing? I'm compensating. I'm compensating through like a $2,000 per month stack. Like I got these immune goblins, I got probiotics, I'm doing LDN, I'm doing some BPC, I'm doing all this. Why? I'm compensating for the fact that my genetics failed me at certain points. And I just didn't know these things. I was using hard will and just working hard to push through that and realize I was working against my gradient when I could have worked with it. I could have probably, trained more specifically. I know that we had Daniel Guzman on going like, oh, manage your overtraining efforts, don't hurt your joints, things like this, or, eating the right things and certain things. But I was doing CrossFit, paleo was big at the time. Yeah, I was like doing all these different things, and it's like
Yeah.
you didn't know where your starting point was. And so now I'm compensating, right, Marcos, with like this stack, which technically nowhere near natty, nowhere near natural
No.
status at all.
No, dude, the natties of today like blow the lid off of like you're fucking enhanced in comparison to 3 decades ago. Like it's
Super.
crazy to think about, you know?
Yeah.
Yeah.
And not a common enhancement, right? Like you wouldn't think of these low dose medications that are starting to emerge earlier on as a result of understanding deeper knowledge as to like again, being on the proactive side, right? It's very interesting and I haven't really been thinking about it much until just now as you're starting to talk about these things. And yeah, like I guess you're right. Like Gattaca's like right around the corner, huh? Like can the twin brother of the, cyborg or whatever it was be able to withstand the test of time? And, goodness gracious, he did swim further than the brother that ended up drowning in the movie. Sorry,
Yeah.
spoiler alert, guys, if you haven't seen it yet.
I know.
Just
I
wait
like
for
just
the movie.
I like just saw it 2 years ago. Someone was like, "How have you not seen Gattaca if you work in genetics?" But it's actually such a good movie. I like highly recommend it. But
Yeah.
I feel like also like we haven't even talked about gene therapy, which I'll just talk about really quick, which is I think like the biggest, probably the most beneficial in my opinion thing of CRISPR. So CRISPR, for those of you who don't know, it's like a way to edit the genome basically. And there's an approved medication for sickle cell anemia through CRISPR.
Mm,
So we're now like injecting people and altering their DNA who were born or who have sickle cell anemia, and then now we're altering their DNA so they no longer have it. So removing diseases out of the population. Like I know they're developing one for HIV and AIDS, for example. So it's really interesting technology too.
wow.
That's
What
I love that.
what's the so what is the trade-off if someone had
Yeah, that's a good
been
question, Mark.
dealing with some sort of illness, I guess you would say, like sickle cell is going to be an illness, to then go in and do that. Are there other things impacted by it? Because like I feel like nothing in this life is that simplistic where you go in, you remove the invader, and then boom, like we're
If there's
good
a
to
trade-off,
go.
it has to be.
There has to
And
be.
that,
Or
yeah, that's like the biggest question. Like,
mm,
would you do gene therapy knowing there's no long-term data? Because we don't know if it's going to impact these patients. Right now, they seem to be okay. Like, who knows in 10 years if they're going to have
yeah.
an issue.
That's just me. I'm like a guy that's like, this looks good. I'll try it out. That's
I
just
know,
me.
especially when you have a disease, but it's one of the things like when participants sign up, they basically we don't have any long-term data of altering the human genome when they're living.
Yeah.
I think that goes back to like the age old question of like what is longevity truly, like as it is like this is a very what the fringe, there we go. It's a very fringe topic to be dealing with that, but nowadays it's kind of commonplace. Where cinegenics first started, it was on the fringes, and now it's like, well, I kind of trust it quite a bit
Well,
because we
I
have
mean,
like
the
30
HRT thing,
years. That's what
right?
I'm saying. That's what, yeah, I'm saying
Like
HRT
30
as an
years ago, we
example
were
of
the
it.
one. I'm not Cinegenics, but it's like Cinegenics was locked and key on HRT, and it took 30 years for them to take the black box off of like progesterone and estrogen for women. Like,
Yes. And
Literally.
as more evident, and here's the thing, like I actually like it because my wife more recently is starting to deal with some of the niggles of like being 37. She's like, why am I like this, that thing, other hurts now? What's going on? I was like, look, now you understand why people would come into our clinic and want to look for a remedy because they want to just continue living their 30-year-old self, right? And as you start dealing with these things because you're under recovered or the hormones don't produce like they did because there's just, I guess the best analogy is that like you drive a car, you get to 250,000 miles, like the maintenance on it, like it's a little more frequent, right? Like it can still drive and perform, like we're talking like a Honda Civic here, like you just want like high miles, you can keep going and cruising and doing the things that you need to do, right? Going 65 on the freeway until you can't, right?
Mm,
And so I'm asking, funny enough today, like I had another physician as a client patient come in. He was like, talking, it's like, oh yeah, like maybe your wife should actually kind of start including a little progesterone. I was like, interesting. And say more.
mhm,
Just based on some of the things we're talking about. And I was like, hmm. I was like, if she was open for it, right? And on all these like kind of like fringe ideas and topics, it's very fascinating to think like how quickly we are now, especially with the advancement of AI, to adopt utilization of these things, with their off-label utilization, right? And I again, like Seamus, I know that you would be all for it, right? Obviously for certain things, especially because like you said, hey, does this LDN lead to better psoriasis symptoms, right? You'll take the trade-off, whatever that might be, based on the utilization of that. That would be the case of, again, like the man. I feel like the side effects of a lot of current drugs that exist on the market, for example, are the reason why they still exist today, right? Oh, the failed blood pressure medication led to the best boner med of all time, right? Like
mhm.
sometimes certain failures lead to other successes, and I'm much like you, Seamus. I'll take those risks. Give them to me. Let's see
Cool.
how it goes, and use a little
Yeah.
bit of anecdote versus just pure scientifically backed literature that's like hard to
Right.
even study because no one will touch it.
Yeah. I feel like a lot of times too, like, I mean, think of like GLPs and microdosing GLPs and stuff. I think everyone was like, don't touch it. And now it's like everyone's been like, it's helpful with this and that. So I feel like I always feel like the longevity and the functional space is ahead of the time. And then they always basically like the traditional space will be like, no. And
Mm.
then the traditional space catches up and they're like, we never said that. And I have respect for both worlds, but yeah. And like, I always think like when I first was, I mean, I grew up in like a very crunchy family, a very holistic family. I'm so thankful for that. But, so like when I was in the traditional realm, I kept being like, I don't understand why everyone's like so against a lot of these holistic viewpoints because also they're like ancient medicine. Like Eastern medicine has existed for so long and has been helpful. And then now we're just adding like evidence and science to why it's been helpful. And then the
Mhm.
traditional world's like, okay, we get it now because there's a paper behind it. But sometimes it's like, okay, well, we also have to think about like, I'm sure there's been like people using this, maybe even with meds, like there's certain herbs that maybe that started off as, and then we like
Mhm.
adjusted the compound in the lab or whatever. So I always
Yeah.
think like the ancient Eastern religions and medications, like, or sorry, healing modalities, like they knew what they were doing.
It's clearly like the human condition is to like kind of learn and then be able to like kind of pun intended, like extract out like the purest version of the thing to then make it more available. And that's where, understanding bioavailability as it pertains to certain supplementation, right? It's like, yeah, curcumin is great. We've been using it for millennia. They're like, what's even, or sorry, turmeric is great. What's even better is curcumin. And you're like, oh yeah, guess what really helps activate it? And it was like you said, standard philosophical Eastern people were like, yeah, we just always cook curry with black pepper and we
Yeah.
had like lower inflammation risks. And now
Yeah.
they're like, You know?
Exactly.
That's what they call it. They call it like biopurine or something like that, and they have like a
Yeah.
trademark on it now, right?
Yeah,
Yeah.
it helps activate it to make it like 99% bioavailable. All it
Yeah.
is like black pepper extract, you know?
Yeah. Yeah, and I feel like that happens so much with like just meditation and mindfulness and stills happening where we're like, "Oh my God, look at the brain scans." And like the monks were like, "Yeah, like we told you."
Like we didn't
You
need an
know.
MRI to tell us
Yeah.
that our brains we're just enlightened.
Yeah, exactly. They're like, "Yeah, we told you we were enlightened." And we're like, "Whoa, we can see it." It's insane.
Yeah.
That's so
Uh,
funny.
wow. I mean, genetics is fascinating. I think the thing behind it though is like you just said, like everybody's like trying to get your money as though there's like these different tests out there. Ours are better. You need to do ours. But you just said, like, again, realistically, kind of not really, just kind of depending on how many you do. I mean, all into like, here's a question, like, in terms of total cost, one individual might spend in the current landscape, how much would it be? Like, creme de la creme, I want to know as much about me. And then, like, what would be like a realistic, like, what you should kind of look for in terms of cost? I think, like, to help a consumer out, essentially.
Yeah, totally. Okay, so I feel like it depends. So like I'll give an example. So I did this with a patient who wanted to know everything. So we did a pharmacogenetics report, we did 3x4, and we did a medical high risk genetics screening. And then, yeah, we did. I said pharmacogenomics. Perfect. Yeah. So basically, like the pharmacogenomics, the functional tests are usually around like 300. And the genetic risk, high risk can sometimes be used with insurance, but if not, it's usually around like 350. So when people are spending like thousands of dollars, I'm like, okay, that's probably not the best lab. The only time that I have patients spend thousands of dollars is fine if we're doing whole exome sequencing for, a child with multiple developmental delay or autism and, insurance isn't covering and there's some stuff with that, or preconception if we're doing like karyotype and all this extra stuff. But otherwise, I feel like it's so much more affordable than people think. And then I also think that genetic testing, like, always look at who founded the company, if they were a scientist or not, or have any, health background. There's a lot of companies who have like founders, or if the founder doesn't, see if they have a board, like a clinical board, because there's a lot of companies that don't have either of those. And so the reason that's important is because we need to also make sure we're choosing the appropriate genetic tests to be validated and put on the report. So some like genetic tests will have these genes that we don't have enough evidence for at this time, and they do more harm than good for like,
Can I
you
pause
know,
in on that real quick? Because
yeah,
like Natalie are in the same space, probably go to the same we bump shoulders with these people. Marcos has too, and it's like some of these folks is like, for example, the technology space has coming into the genetic space. So you have like a tech person that's like very tech savvy, and they
Hmm.
got some idea of like what genetics could look like, right? They have no understanding of genetics, no chief scientific officer, no board, no rigmarole. They give you a printout, and I've seen this because I've done some, secret shopping, and it's like, thanks for the 500-page printout. There's no counseling on this. What do I do with this? ChatGPT couldn't even do anything with this. Like, no like practical way of explaining it. So I do want to like pause there because it's like I think what Natalie's harping on is like making sure, hey, filter out the best. Who's the founder? How do they do it? All these different prerequisites. But go ahead
yeah.
though.
Yeah, no, totally. I agree. And I think like the last thing too is like the security safety piece is so interesting because like as genetic counselors really started mostly in the preconception space, like even like in the 90s, early 2000s, maybe even before that, genetic counselors were doing preconception genetic testing. And then we kind of became more involved in other specialties like cancer and BRCA testing. But anyways, the point of that is like genetic testing was always in a healthcare setting under HIPAA. And then all of a sudden, like ancestry tests came out, like 23andMe and
Mm.
Ancestry, and we sequenced the whole genome. And so then direct to consumer companies for genetic testing came out, which was like so different for genetic counselors because we were like, wait, that's a health test though. How are people able to order that on their own? So, anyways, with the whole security safety thing, it is a really weird, interesting question that's,
Yeah.
because it's like now we're not like, because we're a medical HIPAA compliant practice and we only use labs that destroy the sample and don't sell your data. But like when you're going to order it, just make sure like you're looking at like who's handling the data. Are they going to sell my data? Like what's going on? I think, I kind of fall in the middle with like my personal viewpoint is, you know, I'm like, oh, my data's everywhere. Like I'm like, okay, that's okay. But when it comes to high risk genes too, like you really don't want that. That is like really health
Yeah.
information you want protected.
This is one thing too, and I know this is like a whole nother conversation. Again, a surprise maybe to Marcos tonight, but like this is almost like an episode of Westworld, like this like future AI type show, where there are certain laws protecting you, not us, but protecting our lineage, right, Natalie? Where companies 100 years, 150 years from now can't hire if you in your genetic line had something and they found out about you, they still have to like hire you because it's like certain laws are protecting people from genetic, what is it called? Genetic
Just
Genetic
discrimination.
discrimination.
Yeah.
discrimination. There it
Yeah.
is. Yeah.
Jesus,
Yeah.
is that
Like
an
Gina. Yeah, no, GINA. So GINA is a law, Genetic Information Non-Discrimination Act. It's a federal law. Protects you against health insurance and employers from using your genetic information against you. So that's really important when you're doing cancer testing, for example. You're at high risk cancer, like health insurance can't deny you coverage, or an employer can't be like, well, you're predisposed to cancer, I'm not hiring you. But like life insurance, long-term care, and disability insurance can take that information into account. So it's just like, you know, it's really
better to know
helpful.
nothing. It's better to know
Yeah.
nothing. Just because if you
Yeah.
have no, if
Oh,
there's no paper trail, you're fine.
Yeah.
They'll underwrite
who is
you.
this guy? Where's his credit
Yeah.
score?
Yeah,
Yeah.
it's like
Yeah.
what you. It's like when you cease to exist for that long.
I know. No, that's why you always work with a genetic counselor so you can get life insurance and long-term care before testing.
There's a lot. There's a
Hilarious.
lot of implications, and certain things that do get utilized can come at the expense of lack thereof of underwriting and coverage in certain areas. And I mean, even however the verbiage is written, and then trying to be understood by like the actuarial scientists that will then determine whether or not you will or will not be covered. I mean, this is if there's one thing I can really hope to make a difference with in the future as we continue to grow Seamus, is like helping the average consumer like learn from my mistakes or like going through these things. And maybe that's the reason why like God is like, putting me through this, is to like then figure out the solution a little bit better. Because Natalie, I mean, my wife just did her due diligence. She's like, you said something looked off, quote unquote, as a physician. She's done screenings. She has a thyroid nodule, which is benign. It's been biopsied. It's been doing everything. We were denied coverage from a private medical. But granted, private, again, they can do whatever the fuck they want. I get that. But denied as a result of like, well, you didn't remove it. It's like, but there was no indication to remove it. Right. And then additionally, she had screenings done. She's like, something feels off with like heart rate stuff or a murmur or whatever. Or that, the physician made a comment, led to anxiety, and it led to her wanting to pursue things further, so much so that multiple screenings to get done, all of which came back negative. That also was like a knock against her, right? So here we are trying to do this, and again, but
Just to do the screening was a knock against your wife.
the screenings, dude,
That's
screenings
so
was the
weird.
reason we didn't get underwritten for a policy for her and the family. Here's the funnier shit behind this, right? This is United Healthcare. I'll just call it out, spade a spade, right? She did her due diligence. She did her screening. She's healthy. I mean, we could go back to the physicians to get the paperwork and say, like, everything is in the clear, right?
Yeah.
And it is benign, right? Like, everything is good. They wouldn't underwrite it for that particular policy. But their subsidiary company is where we actually get her insurance from now, but we have to pay $250 more. Seems shady to me.
Yeah.
Right? Because they're like, well, this policy doesn't care about that, but this policy does. So because we did our due diligence and we actually disclosed this medical information,
Yeah.
we're fucked.
Yeah.
Right? Crazy. I'm
Insane.
all for it. I mean, most of the times I don't like government regulation of stuff. Like, again, like it seems like when there's oversight like this, it's like part of the reason why health insurance costs are exploding as a result of what they think should be included with a basic care plan. Here's the thing that most people need: an actual wellness visit they can get into on time within a reasonable amount of time, right, to look at things on a proactive level. They need to be able to go to the ER visit and not get fucking bankrupt. I mean, as a young family, that kind of sucks. And there's a lot of like little itty bitty. Those are like the main things, right? Like you just want to know for sure. Like if an accident happens, you're not going to go bankrupt. You can go and actually see like that person, the provider, which I know both of you don't have kids yet to like have to deal with that particular instance, but let me tell you, the number one thing as a younger father that's not like super high up in, because I got started a little bit young, this is the reason why we're dealing with another thing altogether, which is population decline, and people don't want to bring in kids into this world as a result of like the shitty systems we're dealing with. So hopefully all the canceling or certain types of advantages that genetics can bring in and usher in can help these people actually like give help, at the right cost to individuals. Like imagine a world where it's like, yeah, the likelihood of this happening is like very slim. Actuarial scientists are like, yeah, this person, even if they do fuck off, or if they can show that this is like again, very low percentages, in addition to doing whatever these basic physical requirements would be to be insured at a certain rate, dude. I mean, like we know it's hard, right? Seamus as health coaches to get into the gym, eat healthy, show labs of doing certain things. Maybe it is people getting the particular medications like you talked, like based on their pharmacogenetics, Natalie. Like I feel like there has to be you just told me basically for under $1,200, I could pretty much know everything I need to know about myself, because you didn't mention the 3x4 cost, but you said 650, three x four is like what, $400, right? So under 1,200, I'll say safely. Yeah. So I don't know.
Yeah.
I hope that the screenings and what the genetics can do is provide,
Marcos.
dude. I've
How to
been
handle the health screening, health insurance rigmarole. It's kind of like that episode of South Park, the Ozempic episode. He goes to the accountant. The accountant's like, this, and it's like, go over here.
Yeah, that's
yeah.
literally that. I know exactly what you're talking about. It's such a good part of the episode.
Well, it's funny because then it's like now I'm living it, and I was like, God, they could not have been more right as a satirical,
They're
version.
the
Granted, it
best.
was like getting coverage for Lizzo, only for Lizzo to then eventually go over there and actually get GLP-1 therapies after it was all said and done.
Oh my God, so good. No, I literally, South Park is just insane how right they get it.
Yeah. But Natalie, this has been fantastic, and I know we would, continue to pick your brain and dive into deeper topics, and I went on a tangent there, but I'm really passionate about it, as you can tell, as to like, you know, in certain conversations and rubbing shoulders with individuals here, even more so recently, it's like, isn't it? Seamus always uses the word, it's serendipitous how at the moments when you're dealing with something, there's a conversation to be had about the person describing something to you. That happened the instance as I was trying to get coverage, only for somebody who's like effectively a lobbyist to say, like, you're young and healthy. You have to pay your premium. I was like, to get no coverage? He's like, yeah, because the other people that can't afford it can't get care then. I was like, I can't even fucking afford it and I can't get care. Cause it was like this whole, I was like, make it make sense.
Yeah,
I was like,
makes me.
seriously, make it make sense. He's like, no, that's just how it's always been. It's not a perfect system, but that's just how it's worked for forever. And that's why we should care more about getting into the deeper root causes of stuff for sure.
Yeah, great mic drop.
Good, dude. This is so good. I think at some point, I can't wait to read what Aaron Souza is talking about with the healthcare system. This is what like Jevity is doing. I don't know. It's just
Dude, I mean, that number he'd mentioned for everybody that may have like, come along with Natalie for the ride today, really go listen to, I wish I could just snip it and link it right to this if I knew how to edit better. Um, he had mentioned just like the cost on the general consumer, or from a social perspective, of moving the viable age for Social Security back 1 year, and the reduction of cost of like in the trillions, right? Like he quoted a number that I was like, what number per person? And he's like, yeah. And I was like, how? Like, doesn't even make sense. He's like, well, they're earning more, it gets taxed more, right? As a result, there's more money in the system. They're not also taking from it, they're contributing to it, and it makes a world of a difference. And then I think my parents were like, oh yeah, they're like supposedly, floating the idea of moving Social Security back. I was like, fucking hilarious, right after we had an episode that discussed that exact thing.
Oh my
So
God,
yeah. And
crazy.
people just live longer. I mean, the more we know how to keep people alive, it comes at the cost where the socialized system doesn't really work anymore, because it's no longer 3 years of strain from 67 to 70 when that's like the average age of death. It's like till 75 or whatever it is now.
Yeah,
sorry, Natalie. No, Microsoft. I'm like our own show here.
that's
I
okay.
know.
But it's like this is something I'm talking about with VO2, for example. Like I'm doing a whole conversation about VO2 because I don't think anyone's explaining it properly. But like
Yeah,
this is the thing where it's like, why are healthcare costs so high? When is it the highest? It's not at our age. No, it's when you're in the retirement home. That retirement home is a whole $1 trillion market. Why are hedge funds buying Asian retirement homes, Korean retirement homes, Japan. Why? Because those are the markets where people are there for 30 plus years. They're a recurring member because they're retired at 65. They're living until 95. We're having more centenarians now. Why? So it's like understanding the economy of that. It's I'm doing a whole thing on it. But anyways, Natalie, Marcus, I'll let you finish up a few more questions. Maybe let Natalie chime in a few more things. She's the expert today.
No, I get it. Well, I feel like it's so true. I like that's where I feel like the whole lifespan versus health span conversation comes in too, because it's like, do you really want to live longer when you're a vegetable, or do you want to do all the things you want to do later in life? So I'm like, with all the people living a super long life because we can keep them alive with our technology. But that's where I feel like our space really shines with health span, because it's like, I feel like most people would say, no, I really don't want to live like the last 10 years in a wheelchair. Like the point of me living longer is to like run around and travel and play with my grandkids? So I feel
Yeah,
like, yeah, the power of the longevity, but like more health span, like functional space.
yeah,
And to keep more people that are very passionate about their practice doing it for even longer is something that is incredibly valuable because you have more hands on deck to save more lives. It was evident today. The physician I have in, he's a, but I think technically he's classified as a neurosurgeon, right? But not like brain surgery, but I think it's classified under that guise, right? He focuses mostly on like the neck and spine, right? So I think that's why it's classified that way. And he's like, I'm going to be doing this until I'm 80. And I was like thinking about that. He's like, I will not get a shoulder replacement, which would probably enhance his longevity a little bit because he's so the mental component of the physical task required to do his surgery that's what makes life worth living for him. That's his longevity. And mind you, this individual has a VO2 over a level for a 70 over 70 patient that to me is like a unicorn. If they come into my office and they have a VO2 over 30 from a bike standpoint on a cardio coach, they're in great company. Body fat percentage. This guy is just dialed. And I was like talking to
that's
my doc, I'm
wild on
like,
me.
I was like, yeah, I would love to be. Do I have anything to really bring to the table here outside of like, what drives you, man? Like, he's like, surgery. I was like, there we go. He's like, so I got to keep my hands. It was that exact thing that you're describing, Natalie. It's like, the quality of the years and not the number that matters. And like when you get I mean, again, like if tomorrow I was removed from the longevity space, I've already absorbed everything I need from like the people that came in, the understanding, but like it made it very evident that the number one thing is like keeping your ability to do the things that keep you human. That's the number one thing. So
Exactly. Yeah.
yeah.
Well, Natalie, we could keep going on about this
No, I
stuff,
know.
dude.
Gus,
It's
thank you
so
so much.
good.
This has been like you got me in I'm a really talkative, chatty mode today because like you're pinging on things. I'm like, oh, I've been thinking about this a lot lately. Especially because I've been up since 4 o'clock this morning on a long walk, and I'm like, shit, like what's gonna happen today?
I love it. Those are the best when you're just like so tired, you just say what's on your mind. That's the
Well,
best type of content.
it's the best. Well, Natalie, thank you for being on for over an hour. We've been talking for like 90 minutes now and recording a little bit here, but you've had a lot in your life happen, married, the business is going on. So thank you so much again, knowing your busy schedule and your practice to come on and showcase to us. Where can people find you if they want to work with you? I think you said earlier, like with the board stuff we were talking about, like what certain states is that, like who can you actually help out and let them know where they can be?
Yeah, thank you so much for having me. So you can find us at our website at www.goldengeneticshealth.com. We have two Instagram accounts. One is my personal, so Genetics with Natalie, and then our business account is Golden Genetics Health. And then we are fully licensed in California, Florida, New Jersey, and also can see patients in New York and also 10 other states that have licensure differences. So we can see patients in a lot of states now. So if you have a question on if we can see you in your state, feel free to reach out. If we can't, we'll find someone who can help.
Perfect. 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 Marcos, you want to close this out, my man?
Yeah. Again, Natalie, thank you so much. Thanks for getting me chatting and, a passion fueled, you know, endeavor. I love it. I think, your points on your specific things. I love what you're doing. Like you mentioned right before we got on camera, like recording about trying to be a part of just so many conversations so people can like hopefully get that tidbit of digestion that they need. I had a another patient come in here recently and say like kind of that exact thing. People are learning from podcasts as like their number one medium. And I was like, you're so right. Like I am going into those deeper dives with people that are, that I liked what they said. So if they have the opportunity to constantly speak about, even if it's the same topic, it may not have been the first way you said it, but it may have been from what, we had to provide with our queuing up. So hopefully there's content and information that might be new and unique, or how you said it just resonated with the audience a little bit more. So thank you so much for your time. You've been a pleasure. And sorry I missed the first one due to the hell if I know what it was at the time. So guys, macro perspective peeps, until next time, go find Natalie, go reach out to her. Hopefully if you're in the market for looking a little bit of a deeper dive, even deeper than just a normal biofeedback and biometric type of screening, you'll be able to ask her those questions. So till next time, y'all. Peace.